water, ice, plate and forks. Seriously? Service with a smile?
Some things should just be standard. RevVoice has 17 standard calling features. Cut the blue wire. Get RevVoice, save money.
The Prime Minister today giving a little more insight into national health insurance. This as doctors band together calling for the government's attention on the issue. The latest on Bahamara, plus why is this sign outside a public park? We've got those stories and more coming up tonight. I'm Kyle Joaquin and NB12 starts now. Topping news tonight, Prime Minister Christie says the government has postponed national health insurance long enough and must move ahead, despite numerous stakeholders saying they need their concerns addressed before coming on board. His comments came at the 2016 Bahamas Business Outlook at the Malia Resort today. He also revealed information about plans for catastrophic care. Simone Davis reports.
We postponed it long enough. No.
That was the Prime Minister's response when asked if there is a real possibility his administration would postpone implementing national health insurance until all stakeholders feel comfortable and completely understand it.
Mr. Christie reiterated that he would seek further advice from experts in the industry and also speak with doctors to ensure that everyone gets a fair opportunity to cause the policy to be finessed.
I'm going to seek further advice on the matter for people whose life expertise has been in insurance and in health insurance. And I'm going to meet with the doctors, and anyone who advises me, they can have access to. Because I want to ensure that everyone has a fair opportunity to feed into the policy.
He also responded to those in the insurance and medical industries who publicly claim that they've received insufficient information on the scheme and those who said they don't understand it. He added that he thinks those individuals should consider speaking directly to him to express their concerns rather than speaking to the media first.
You are not going to be speaking to me from Mount Olympus, so to speak, the Tribune, the Guardian, and make that into a consultation. If you say the people are not consulting you fairly, then the Prime Minister, you've met with the Prime Minister, meet with him again.
Christie said the government is fighting hard for public insurance because it would be a default position for those who don't have private insurance to be covered under universal health care. One day after the NHI registration started, Labor Minister Shane Gibson revealed that the government intends to create a special fund when it launches NHI to assist people who have catastrophic illnesses. Gibson also mentioned that the fund would be established when the government launches primary health care services, which is expected to happen in April. Today, Christie said the fund would operate as an emergency fund that would cover the development of the NHI program until the benefits package is offered.
We created a fund. The fund is a temporary placement of monies to cover the period that it will take to evolve the national insurance program to the point where the benefits package is being offered and clearly defined. So this fund is an emergency fund that will be related to the diagnosis of the specialist and to be able to go into that fund to meet the cost of whatever the treatment is.
And according to Christie, that emergency fund would be valued at more than $20 million.
Well, I think they were talking about 24, 25 million in this period that we have. We have a period that goes into the next budget, all right? And so it's a question of when we reach the point where primary care is introduced and where people are able to go to the doctors and do that. So, look, we have, it'll be wrong. It'll be wrong given the commitment of my government to talk about delay and postponement.
Reporting for NB12, I'm Simone Davis.
Well, if national health insurance is going to work, healthcare professionals must be included in the process and respected. That's the point President of the Bahamas Medical Association, Wesley Francis, drove home during a press conference at Princess Margaret Hospital today, where he said the association's doctors have some serious concerns that need to be addressed. He also decried the lack of education and transparent and productive dialogue surrounding NHI. Dana Smith reports.
A toxic political environment and a lack of education have contributed to what the MAB today called a very large information gap. The association's president today outlined a number of outstanding issues that the organization wants addressed, and he also hit back at National Insurance and Labor Minister Shane Gibson for his suggestion that some doctors care more about the money.
It is unfortunate that we are here today because of a lack of consistent and meaningful engagement of all relevant stakeholders, the most significant being the public at large. We find ourselves now with what we view as a very large information gap because of a lack of education, a toxic political environment, and many groups with competing interests, precluding honest, transparent, productive dialogue on such an important and landmark health reform policy.
Flanked by more than 30 doctors and healthcare professionals, Francis said the MAB stands by the comments made by the president of the Consultants Physician Staff Association, Dr. Loxley Monroe, who accused the government of ignoring and marginalizing the views of local doctors and warned it will not sign on to national health insurance unless its concerns are addressed. His comments prompted Gibson to declare that government would not be held hostage by a handful of doctors who think the mighty dollar is more important than saving lives. Well, Francis said political rhetoric has no place in the discussion. He said we cannot allow only the most extreme voices to get attention.
Insulting professionals or stakeholders is just wrong. And it diminishes who we are as Bahamians. Corporations cease to exist when people feel that their voice or input does not matter. This plan will not work if we feel that stakeholders who disagree with us are motivated by malice or greed. Let me first say that I'm a member of CPSA. I think I paid my dues. And what Dr. Monroe expresses is the feeling that we all have. We got some serious concerns, and they need to be addressed.
Francis said years of broken promises have led to a general global distrust of government and its ability to bring about real change. He said many don't trust the government with this major reform and feel that the capacity is in the private sector, and this could be the only reason why some people aren't on board with NHI, even if it could have significant long-term benefits. Francis said the MAB believes that ahead of NHI implementation, a few things need to happen first. He said major institutional strengthening and infrastructural development must be tangible and visible. Public clinics and hospitals need to be renovated, and there should be further investment in information technology and staff development. Doctors also have questions about cost.
Healthcare is not free, and no public should be misled. The public is a major stakeholder and needs to be properly educated as to what they will receive under this plan. NHI will have a cost to everyone, and we should all be a part of the discussion on how it is financed. The benefits package has to be known. Our patients need to be informed as to their role and responsibility in this new reform as they share in the cost. We need an open disclosure, or discourse rather, on how to contain costs, especially in such a fragile economy. Our unemployment rate needs to improve if this is going to work.
Francis said the Medical Association has been involved in the implementation process since the onset, but the meetings could be more productive. He said, "We don't need more PowerPoint presentations. We need to sit down and work out the process." He said a lot of physicians feel they aren't respected, and that has to change. Now, both Gibson and Deputy Prime Minister Philip Davis suggested NHI could move forward even without buy-in from major
stakeholders. But when NB12 asked about their comments, Francis said this.
That's a very loaded question, right? But I just will say, you know, if we the residents of the house and you the architect and you building this house and you ain't have no residents inside it, you have an empty house.
Reporting for NB12, I'm Dana Smith.
Well, government appears to have the tentative support of a group of pastors on NHI. Bishop Simeon Hall and several other pastors say they are disappointed in those who have pulled this discussion surrounding universal health coverage down to the level of personal gain and political mileage.
As pastors, we face on a daily basis the pain and misery so many of our people face due to the lack of access to proper health care. As we understand it, the scheme is indeed imperfect, yet it is our considered belief that this plan, in the long term, will help many persons to live life on a higher plane.
Hall says he calls on the government to listen to credible critics during this stage, but the time is now, he said, for national health insurance, as too many people are growing sick of insurance companies.
Scores of Bahamians have become disappointed in insurance companies and the role they play at different stages of one's life. Persons growing old, like myself, when you reach a certain age, you have to pay an exorbitant sum of money or lose the insurance completely. I've heard of cases where people get too old, and when you need the insurance, that is the time it is canceled. On a weekly basis, we as pastors bury persons who could not afford to live. We believe that national health insurance will, in fact, defend the poor.
When NB12 returns, the latest on Bahamar, plus what's this sign doing outside the Big Pond Park? We've got the details after the break.